For many decades, the dental world has seen titanium implants as the standard. They are presented as a permanent, strong solution for missing teeth. These small screw-like posts are surgically placed into the jawbone. They act as an artificial root. Once in place, a crown, which looks like a natural tooth, is attached on top. This process seems straightforward. It offers a way to restore a smile's appearance and function. Dentists often praise titanium for its supposed strength and durability. The material has been used in medicine for a long time, from hip replacements to surgical screws, building a reputation of reliability within conventional practice. The idea is that titanium is biocompatible. This term suggests that the body will accept it without a negative reaction. The metal is chosen because it is strong and resistant to corrosion. From a purely mechanical viewpoint, it does its job well. It can withstand the immense pressures of chewing and biting day after day. The implant is designed to become a permanent part of your jaw. It provides a stable foundation for a replacement tooth. We are told this is a safe and effective long-term solution. However, this mechanical view often overlooks the more subtle, holistic interactions between a foreign material and our living, energetic bodies. When you look at an X-ray, the titanium implant appears as a dark, dense object. It is clearly distinct from the surrounding bone and tissue. Its metallic nature is obvious. This screw is not a living part of you. It is a piece of hardware placed into a dynamic biological system. The gums must heal around it and the bone must grow onto its surface. While this integration is celebrated as a success, we must ask deeper questions. What does it mean to place a metal object into the sensitive meridian pathways that run through our jaws? What subtle effects might this have on our body's overall energy and health over many years? It is important to look beyond the surface level benefits. We must consider the full picture of what happens when we introduce metal into our mouths. Your mouth is the gateway to the rest of your body. It is a sensitive environment, rich with nerves, blood vessels, and energetic pathways. The presence of a metallic implant introduces an element that is not natural to this intricate system. Understanding this is the first step toward making a truly informed decision about your dental health. We need to think about not just the tooth, but the whole person connected to it. This whole body perspective is essential for true, long-lasting wellness. The term biocompatible can be misleading. It does not mean the material is biologically inert or invisible to the immune system. It simply means that for most people, the immediate severe reactions are minimal. However, a growing body of scientific evidence is revealing a more complex story. Studies have shown that a small but significant percentage of the population has a titanium allergy. This can manifest as skin rashes, chronic fatigue, or inflammation around the implant site. Because the symptoms can be subtle and systemic, they are often misdiagnosed or overlooked, leaving patients to suffer without understanding the root cause of their health issues. Beyond overt allergies, there is the issue of metal ions. Titanium implants are not completely stable. They can corrode over time, especially in the moist, acidic environment of the mouth. This process releases tiny metal particles and ions into the surrounding tissues and bloodstream. Your immune system recognizes these particles as foreign invaders. It may launch a low-grade chronic inflammatory response to try and contain them. This condition, known as peri-implantitis, can lead to gum inflammation, bone loss around the implant, and eventual implant failure. It is a silent battle being waged inside your jaw, often with no obvious symptoms until significant damage has occurred. Many of my patients have shared their personal experiences with metal in their mouths. Some report a faint metallic taste that never goes away. Others describe a strange feeling of energetic interference or a sense of dissonance in their body. This is not surprising when you consider the galvanic effect. When you have different metals in your mouth, such as a titanium implant and a gold crown, your saliva acts as an electrolyte. This creates a battery-like effect, generating measurable electrical currents. These unnatural currents can interfere with your body's own subtle electrical system, potentially impacting nerve function and the flow of energy along acupuncture meridians. These energetic sensitivities are real. While they are not yet fully captured by mainstream scientific instruments, They are a valid part of the patient experience. Your body has an innate intelligence. It knows when something foreign is present. For some, this awareness is heightened. They may feel a shift in their overall vitality or notice that certain health issues arose only after the implant was placed. Listening to your body's wisdom is crucial. It often tells us things that lab tests and x-rays cannot. A holistic approach honors these subjective experiences as important pieces of the overall health puzzle. The process by which an implant becomes stable in the jaw is called osseointegration. The word literally means bone integration. When a titanium implant is placed, the bone-forming cells, called osteoblasts, are expected to migrate to the implant's surface. They then begin to deposit new bone matrix directly onto the metal. Over a period of several months, this new bone growth envelops the screw-like threads of the implant. This mechanical interlocking is what gives the implant its strength and stability, fusing it into the jaw. It is a remarkable biological process, showcasing the body's ability to adapt and heal around a foreign object. From a conventional dental perspective, successful osseointegration is the ultimate goal. It means the implant is locked in and can support a crown for chewing. However, we must look closer at the nature of this bond. It is not a true biological fusion, or like a bone healing to itself. It is a mechanical connection. The bone grows onto the titanium, but it does not grow into it. There is always a microscopic separation, an interface between living tissue and non-living metal. This interface is where potential problems, such as the release of metal ions and chronic inflammation, can begin over the long term. Think of it like a boat anchor in the sand. The sand packs tightly around the anchor, holding it firmly in place, but the anchor never becomes part of the sand. It remains a separate foreign object. Similarly, the titanium implant is anchored in the bone, but it never becomes a living, integrated part of your body's matrix. This fundamental difference is key. Living tissues are designed to work in harmony, communicating through complex biological and energetic signals. A piece of metal cannot participate in this communication. It sits there, silent and isolated, for a permanent disruption in the biological terrain. This mechanical view contrasts sharply with a more holistic understanding of the body. In whole-body dentistry, we recognize that every part of the body is interconnected. The jawbone is not just a scaffold for teeth. It is living, dynamic tissue connected to the rest of your system. The goal should not be to simply anchor a replacement part into it. The goal should be to support the body's health in a way that is harmonious and biologically compatible. True integration goes beyond mechanics. It involves materials that the body can accept and incorporate without triggering a constant, low-level defense response. Fortunately, we are no longer limited to using metal for dental implants. There is a superior alternative that aligns much more closely with a holistic biological approach: zirconia. Zirconia, also known as zirconium dioxide, is a type of ceramic. It is completely metal-free, white in color and exceptionally strong. Unlike titanium, which is a gray metal, zirconia's tooth-like color means there is no risk of a dark line showing through the gums. This offers a more natural and aesthetic appearance from the very beginning, creating a beautiful result that looks and feels more like a real tooth. The most significant advantage of zirconia is its superior biocompatibility. As a ceramic, it is electrically neutral. This means it does not conduct electrical currents or create a galvanic effect in the mouth. This is critically important for maintaining the body's natural energetic balance. Furthermore, studies have shown that zirconia surfaces accumulate significantly less plaque and bacteria compared to titanium. This leads to healthier gums, a lower risk of inflammation, and a reduced chance of developing peri-implantitis. Zirconia is kinder to the surrounding tissues, promoting a healthier and more harmonious integration with the body. When we compare them side by side, the choice for a health-conscious individual becomes clear. Titanium is a metal that can corrode or release ions, trigger allergies, and disrupt the body's electrical systems. Zirconia is a bio-inert ceramic that is hypoallergenic, non-corrosive, and does not interfere with your body's energy. It supports healthier gums and offers a more natural aesthetic. The integration of bone with zirconia is also excellent, providing a strong and lasting foundation for a replacement tooth without the inherent risks associated with introducing metal into the body. It is truly the next generation of implant dentistry. I invite you to think deeply about what you put into your body. Your health is your most precious asset. Making informed choices about dental materials is a powerful way to protect and enhance your overall well-being. Look beyond the conventional standards and explore options that honor your body's innate intelligence. If you are considering dental implants, ask your dentist about metal-free zirconia alternatives. To learn more about the connection between your oral health and your overall vitality, I encourage you to continue exploring the principles of whole-body dentistry. True health begins with conscious, holistic choices.